right. Should we talk wearables?
Yeah, absolutely.
Yeah. So I'm joined by some amazing panelists that are some of the greatest thought leaders in all of wearables, and we're going to get to that in a second. But it's a very interesting category in time for wearables. We're seeing an explosion just in the last few years to almost $26 billion. But in 5 years from now, it could be as high as $60 billion. And somewhat related, and we'll talk about this, is augmented reality, which could be from almost nothing to 40 billion in 5 years. But it's not an easy road. We've seen companies like Nike and Jawbone stumble a little bit, pull out. Apple, maybe a little, who knows where they're going. I have a lot of faith that they'll come through. And then we've seen really exciting examples of maybe more niche players like Misfit that have had a great exit and are in the hands of what appears to be a wonderful home. I also think it's interesting that medical wearables probably had a slower start, but are predicted to be maybe at least 10% of that market. And I would put forth there's actually some phenomenal examples that have been around for many years. There's a $8 billion wearable market in the medical marketplace that sits on the most sensitive part of your body, and that's contact lenses. It doesn't quite get counted yet in the wearables category because it's not electronic, but perhaps that'll change. We're also seeing very successful examples in glucose monitoring, where we have about $1 billion in sales, growing to maybe 5 or 10 billion over the next few years. So I think we've come a long way from the fig leaf to being able to be on the body, minimally in the body, or all the way implantable in the body. And we're able to do things like pull data out or provide knowledge to others. And the people on this panel are doing all of the above, so it's very exciting. With that, I'll stop talking, and we'll focus on the real deal here. I'm going to start by introducing and asking a question of each of the panelists. And I'm going to start with Ben, because last night we lost a bet at dinner, or he did.
I did.
And so Ben's the CEO of Perfusia, and he has an amazing product called Lumi. And if you could tell us, pretend you're a user, what would your day be like?
Yeah, so thanks, Chris. The bet that I lost last night, though, really, it wasn't a lapse in my judgment. It was an illustration of how brave Chris actually is. So Lumi, we gave a demonstration on stage yesterday. We have a biochemical platform technology where we're able to generate, measure real-time biochemistry from within the body, where data acquisition is done in a non-invasive way. But more importantly, the platform itself allows for real accurate readings for a very, very long time. So the intervention, the requirement for the sensor being placed inside the body, that sensor lasts for months and years, and data acquisition is done kind of just by a watch. And so from a user's point of view, there are many stakeholders, quite frankly, that could actually benefit from a Lumi system. If you're an individual, and let's say for a tissue oxygen measurement that we did yesterday, I'm suffering from diabetes and I have diabetic foot ulcer, and this ulceration just will not heal. What the Lumi system allows me to do is be able to monitor the tissue oxygenation of my foot so that when I'm in the comfort of my home, I'm able to actually manage and monitor whether or not the therapeutic choices my physicians are actually making is helping the oxygen around that wound area to be high enough where the wound actually can heal. And if I go into the clinic for either surgical intervention or other medicinal intervention, that data is happening in real time, so that when I'm at home, elevating my foot position and things that I'm actually choosing to do in my activity, and that impact on the tissue being oxygenated and that wound healing could happen actually in real time. If I'm a physician or if I'm a payer or a provider, that body of information, for example, if I'm a surgeon, for example, and all of my patients that have wounds that are at risk of not healing, when they're at home, I have a dashboard of my surgical patients. In real time, I can actually be able to monitor, Is the therapeutic outcome where I want it to be? And at any given moment, if there is a risk for one patient, for example, where there's a restenosis event, and then he or she needs to come in and see me, I could actually contact that individual and have them come in real time. So the power really, it lies from a user point of view, is being able to shorten the time in which the activity and the correction could happen very quickly. And you actually shorten the distance for that intervention as well, so that I don't have to make those choices with you being present. I could actually make that choice and make that decision and suggestion when you're far away and in the comfort of your own home or your own environment.
Thank you. So Frank's the Senior Vice President, Neurometrics. And if I could attempt to simplify this amazing product, Quell, that you've recently launched, it's Tylenol, but not a drug. So tell me, if I'm a user, what's my experience like?
So what we really try to do with Quell is make it seamless for the user. And we, there's 100 million Americans suffering from chronic pain, more than diabetes, heart disease, and cancer combined. And it really has become an epidemic. 300 million prescriptions for Vicodin and the generic alternative. So basically one prescription for every adult in the US, yet over half the people are unhappy. So we looked and said there has to be a better way. What we have with Quell is basically wearable therapeutics. It's a wearable therapy. We use intense high-frequency electrical stimulation. We stimulate nerves, which triggers a central response. And we're able to block pain signals throughout the body. And what we really tried to do when we developed Quell is take that consumer perspective. Because if you suffer from chronic pain, you suffer for it 24/7. It's not like it goes away in the evening or when you go out to lunch with friends, and it affects every aspect of your life. So, ultimately what we're trying to do is help people get on with their life and be able to go out for that walk, be able to play with their grandkids, work in the garden, whatever that is, have a good relationship, and make it seamless. So it's wearable. I'm wearing one right now. You wear it on your leg. Not because my leg's in pain. You wear it on your leg because we can tap into your nervous system there. Dense cluster of nerves. We stimulate. You don't feel much. It feels like a tingling sensation. What we do is trigger the release of natural pain-relieving substance in your brainstem, and we block pain signals.
It's amazing. I've had some personal experience in my family with people with pain, and I know when you're in pain, you'll try almost anything. But yet there's quite an epidemic and a fear, rightfully so, of taking opiates. So I think that's just fantastic, and we'll come back to that. So Rick, you've got glasses that save lives.
We do.
Could you walk us through what that looks like? It literally looks like.
Yeah, I was hoping to show a demo, but thanks to the bane of all medicine, interoperability made it so I couldn't get it from here to up there. But I'll tell you about the experience of our clinicians that are using it. So Visor came about from frustration, real frustrations when it comes to medicine. My co-founder is a trauma surgeon, and he's the type who he feels pressured to be perfect all the time. In trauma, every second, every minute counts. And if you want to get a patient in and out within 20 minutes, you have to do certain things, hit certain milestones at certain times in order to make sure that you can get the patient out when they need to be and get to the therapeutics that they need. So what he would do is he would have checklists, like little checklists he put in his pocket, review before the patient comes in, and maybe midway, but usually when your hands are around something squishy, you can't get to them. Also, when it comes to timing, he would set up kitchen timers. So those little manual kitchen timers that tick, tick, tick. Set those up 2 or 3 in the ER, set them up in the OR so that it would ding and he would know where he is in the process. So when wearables came out, specifically Vuzix and our favorite, Google Glass, we thought perhaps now there's an opportunity to get that same outcome of getting help using your checklist, but in a very easy way. So by using Google Glass, our surgeons are able to get checklists, reminders, there's timers just magically floating out in front of them while they're working. And it really helps them keep on track. The other big application is for the whole support staff, nurses, other clinicians, and even the janitors who clean up. they are expected to know hundreds of processes and do them perfectly. They're expected to know how to set up and run hundreds of different medical devices throughout a hospital, throughout a doctor's office. And after you get trained, if you don't use it for a couple months, it's very difficult to remember. If you could have the instructions, again, presented to you in a way that is easy to use, it turns you into a super clinician, and you're able to get anything done. So it takes away a lot of stress, and your outcomes get a lot better.
If we could maybe make that a glass for my wife to put the instructions for myself during the day, I think you might have a bigger market opportunity.
I like it.
We'll have to think about that. So Ashwin, you've developed a platform that can do diagnostic monitoring of things in the body. It does invade the body, but do I experience that? Do I feel that when I'm a user?
Yeah, so what we've created at Sano is a transdermal sensing technology. It's a little patch that you can wear on your body. I'm wearing one here on my arm, pretty small. You slap it on like you would a Band-Aid. Though it is minimally invasive, it's very painless. It feels like a piece of sandpaper is being placed on your skin. And it's actually a chemical sensing platform that can detect analytes in your body. And the one we're focusing on first is glucose. And we're taking a slightly different approach than what some of the large continuous glucose monitoring companies have done in the past. And we're moving earlier on in the patient's life cycle, kind of the pre-chronic condition category, and helping folks with a problem that probably a lot of us have had. We don't really know the impact of food on our metabolism. We've maybe tried a diet and been unsuccessful. What we really believe in at Sano is that nutrition should be personal, should be personalized, and that measuring the outcome of a particular meal, a particular set of choices that we make from a metabolism perspective on our bodies, we can make better decisions. And so in the life of a user of the product, could be a patient, could be a consumer, understanding that the salad that I ate today with the dressing that I ate actually had a more negative impact than I originally thought it would, and that the cookie that I had after dinner actually didn't have as much impact as I thought it would. And really understanding what has a positive or negative impact such that you can more effectively manage weight, if that is a goal, more effectively eat the right types of foods at the right times to make sure that your energy is stable throughout the day, and then eventually down the road for us, manage a disease state or condition based off of that data.
And how timely with the new FDA labeling around foods. So now we can see what's in our food, but we can then understand how it affects our body as an individual. So really cool. I think that Quell will be on the show floor, so you can come down and check it out. Anyone else, I encourage you to come up, talk to the speakers afterwards to maybe see and touch their products. So what's interesting, Ben and Ashwin, we were talking at dinner last night. They're focused on solving initially the same problem, helping people perhaps with diabetes or that might end up with diabetes potentially to avoid that or better manage their diabetes. But you're coming at it with very, maybe slightly different technology and a very different approach to the market. And I'm going to leave it to the two of you perhaps to explain together the differences or similarities and importantly for the audience, how you would think about the path that you've chosen. Because there's probably many entrepreneurs in the audience and there's many big companies and they're trying to identify what are the criteria that I would use to make the decisions for what kind of business or go-to-market I would have.
You want to take it?
Yeah, sure, I could start. You want to arm wrestle? No, Ashwin and I met last night, and I've been a fan of Sano for a long time. And I think the bottom line conclusion that we actually had was that it's such a privilege to actually work in this space. And the privilege is that while there are many, many ways of making a living and many, many ways of creating economic value, we are in a place where we could actually help a bunch of folks and feel good about what we do. And these types of problems, and I think the reason that we talk about the wearables in this space and there's such interest in this room, is that the opportunity to be able to completely transform sort of the most expensive, not just economically, but also productively, from a productivity standpoint and people's health point of view, to be able to transform the world is actually quite profound. And that sandbox is so big and so large that many, many smart people contributing in multiple ways will just make the vision kind of come to reality much faster. And in the field of, I think, our approach versus Sano's approach is that we take the continuum of kind of the management of a particular condition. Let's just use diabetes as an example. The whole notion of consumer versus medical, I think it's a definition of a field or a continuum that's just going to start to blur and go away. Because when you think about it, the strategic goal and planning for any large medical device company is that I'm going to take this really highly regulated and very accurate device and get it into as many people as I possibly can. And so you drive toward the consumer side. If you're a consumer-based company that's trying to do medical, your absolute 5-year vision is I want my data to be as accurate as it possibly can so that people can make much greater and more highly valued decisions, which means that you're creeping toward the medical side, right? And so very soon, the industry is just going to be one big healthcare industry where you have very highly accurate technologies that will be sort of deployed in the homes, if you will.
And you're initially pursuing more of a medical market, is that correct?
No, and that's exactly right. So we are coming at more from the vision of a highly regulated, very clinically accurate sort of a portion so that our technology is actually validated in the clinical setting, but do so with the consumer application in mind so that every part of our product development, every part of our design has a very user-centric component, because we know that's where we're going to get to. And without putting words in my friend's mouth, I think they're coming at it from this other way, which is just brilliant, right? Because at the end of the day, when you go at it this way, the tide is going to rise all boats. And, the opportunity is so large that multiple players actually in it is a good thing.
So Ashwin, what does that mean to come at it from the other way?
Yeah, I think that the end goal of the product being available to as many people as possible and being as accurate as possible will come through regardless. Products don't stay on the market if they don't exhibit the claims that they make, and we're seeing those challenges in the fitness tracking space. And so I think that's our intention as well. The way that we're going at it from the other direction is a little bit. I was thinking about this before coming on stage here. It's a little bit of an analogy to the contact lens versus glasses versus LASIK space. A lot of people have different methods for dealing with that condition. Some people are okay with glasses. Some people are okay with 2-week contact lenses. Some people are okay with dailies. And some people just hate the condition altogether. And as soon as they can possibly get LASIK done, they will. And I believe that's going to be the same way for people who have a very severe chronic condition all the way down to people who are pre-diabetic or maybe have just been told by their physicians that they need to manage their weight a little bit better. And so for us, we're taking the earlier end of the spectrum. We have a patch that's worn on the body that can be taken off on a daily basis, if you'd like, and thrown away after that. And because of that, we're dealing with a population of users that will not want to commit as much earlier on in the life cycle of a patient that has diabetes or a chronic condition, whereas there is a little bit of a commitment to using Perfusa's product, right? But obviously, less of a commitment on a day-to-day basis. And so I think it's more of a style and an interest in committing to a particular type of therapy or particular type of use that will differ from patient to patient. And because ours is so simple and easy to order and get into your home and put on immediately, we're likely going to deal with the patients that have a less severe condition.
And that was a key point that we brought up last night was they're actually both incredibly simple to use and almost unnoticeable. But there's a little difference in how they begin. And having in my past life sold 7 billion plus needles a year, I picked up on the fact that on your technology, it started with a very simple, small injection to get the hydrogel sensor into your body. And from there, it was completely unnoticeable. But that was one of the reasons why you chose more of a medical path. Is that correct?
No, that's absolutely right. I think I love the way Ashwin characterized it, right? There are just kind of usability choices that are in there, right? For us, there's a little bit of activation barrier that you have to go visit, in the short term anyways, a physician or a care provider that's through a little hypodermic needle insertion of our little hydrogel. But then after that's done, it's as simple as wearing a Band-Aid and wearing a watch, and you just kind of forget about it for months. Whereas, the approach that Sano's has is much less of an activation barrier, but there is maintenance that you kind of have to go through as you use it for the duration. And there are pros and cons of both. And for us, because of that initial activation energy, if you will, to go visit a patient, healthcare provider to put the sensor in, we chose the path, I think, of the clinics first. And I think there are a couple good reasons to do that. I think one, because you actually are under the care of a physician, at least in the early stages of deploying the sensor, the bar is high, and we think that if you actually shoot the higher bar of clinical validation and data and usage for actual disease management in patient, then bleeding into a more consumer usage where the bar is lower in terms of performance, we think that's actually an easier path, right? So there was a good reason to actually do that. The second good reason to actually go down from a clinic down into people, quite frankly, is there's a very high value clinical need, if you will, for many of these cases, so that it provides a little bit of an economic buffer for us, right? Mm-hmm. To say we don't have to thread the needle as finely, because the economic value in a clinical setting where the outcome is catastrophic, having a sensor like this that prevent even a small percentage of those catastrophic outcomes is actually a very high value problem to solve. And we think adoption in a clinical setting becomes an easier one to do, to go. But it's a choice that's driven, I think, both by strategy as well as some reality of our technology.
Yep,
right?
That makes sense. And I think those are really key points to take away. And so you mentioned that the line might be blurring ultimately between medical, consumer. And so I'd ask, with the FDA guidance documents that have come out over the last 18 months, thanks to the mHealth Regulatory Coalition, it's really taken us from an opacity in digital healthcare from a regulatory standpoint to a lot of clarity. And there's been 4 guidance documents that have come out. I encourage you to look at them, and then a tool that was also endorsed by CMS. And one of them was identifying that historically, if you had 2 medical devices and you put them together, they had to adopt the highest standards. So if you had a class 3 and a class 1, you put them together, you had to go through a full PMA for both of them. Today, they can be reviewed on their independent merits. And I think as we move to an interoperable, blurry line world, that's going to be incredibly important. So I'm curious, Rick and Frank, do the new regulations, the old regulations matter? Are those important to you today? Would they be important to you going forward or not?
I would say that they are very important. Any type of help that we can get regulatorily to be able to do that interoperability, it's something that we have to do. The technologies that allow us to achieve kind of any endpoint that we want are out there, but they're all kind of siloed. If you have an opportunity to work together, that's when you're going to get the better type of outcomes. We have not had, and our company have not had much issues with the FDA, but as we expand our platform and would like to take the information gathered by using Visor and then putting it into electronic medical health record, that's when it's going to attract some attention, it's going to attract some scrutiny. And any kind of assistance we can have, understanding that we can have, that we're trying to help, we're trying to get the data to where it needs to be so it can be studied, that's just going to be, it needs to be done.
And the clarifications definitely helped us. As I mentioned, as we think about our end user, I mean, we think about, again, that person with fibromyalgia, that person with sciatica, the person with, TMJ, who, how do we help them? And there's certain things, I mean, our product itself at the core is a class 2 medical device. Over the counter, but class 2 medical device. So there's certain things that, we need to be towing the line. But then you start looking at the app, and there's certain things we do with the app which are, in fact...
And that was new, right? You had hardware, and then you added the application.
So we launched with an app, but our app at that point was low risk, under the low risk category.
Okay.
It was doing tracking of sleep, tracking of usage, and that let us get to market quickly. We then put in Subsequently, we put in a 510K to get approval to fully integrate the app in the device. So now you can control the device with the app. You can tweak therapy with the app. But there's certain aspects of it that are completely outside the 510K. So we're incredibly sophisticated sleep tracker. And since our device is worn on the leg, we're able to track not just, did you have a good night's sleep? We're able to track what percent of the time did you sleep on your back, your side, did you have significant leg movement during the night? And the reason that's important, again, getting back to the chronic pain, the person suffering from chronic pain, there's this linkage with sleep and pain. If we can help their pain, we're going to see that actually their sleep quality will improve over time. So it's a pretty good objective measurement as opposed to pain diaries, which is the typical way to measure chronic pain. The other thing is we also know that if you're not sleeping well, it exacerbates your pain. So we can give folks coaching, again, that falls outside of the 510K and outside of that whole thing, but help give them advice that would help them get a better night's sleep, which again, it's all part of that virtuous cycle of regaining and reclaiming your life.
So I am noticing a theme here of the importance of understanding medical regulations, devices, healthcare, but also the consumer marketplace. And so to turn it back to you one more time, Frank, I know in your past life you've been very successful in developing billion-dollar franchises on over-the-counter products that are marketed directly to consumers but are true healthcare products. Today, with Quell, you've begun to have retail distribution. Congratulations.
Thank you.
You've started a direct-to-consumer advertising campaign.
Yep.
But as you just described, it's very much a medical device and has very clear medical applications. Do you see this as becoming more of a consumer play, more of a healthcare play, and how big, could this be a billion-dollar direct-to-consumer product?
Yeah. Well, I mean, I'd say yes and yes and yes. Pain, consumer spending, out-of-pocket spending on pain in the U.S. is $20 billion annually, and people are not happy. As we looked at our go-to-market strategy, we said, there are a couple things we want to do. We're trying to build a credible brand that is sustainable and is a long-term business, and we're trying to scale. And if you want to scale, you have to go over the counter. It's just too slow to look at from a reimbursement standpoint, at least that's our assessment, was there's no premium for a medical device these days. And if you look at reimbursement, diabetes is a great example. If you look at what's happened to blood glucose meters, basically reimbursement is just going to the toilet. Yet we know consumers will pay for better solutions. So we want the over-the-counter approach. On the flip side, there is so much snake oil out there. Whether it's late night television with different braces or dietary supplements. So we knew credibility was important. So we, on one hand, try to build the credibility through physician recommendation, through clinical studies, but we're going to win because a consumer has a problem. They recognize we've got a better solution and we can meet that need better than anyone else.
But I did notice that some of the Blue Cross Blue Shield organizations are piloting and working with you. So does this just go back to 1 foot in, 1 foot out, but that's all a good thing?
Ultimately, we think we should be reimbursed, but we're not going to wait for it.
Yep.
So, the good news is, particularly around digital health, there's a lot of room for experimentation. So we did announce something with Primera where we're looking to do some experimentation, and it's pilot studies. And the fact that we can not only deliver therapy that has minimal side effects, that's well documented, but we can collect data to show easily, without all the expense of doing a formal clinical study, we can gather data both in usage and from the app and from sleep to do experimentation. And to some extent, we're, how do we fail fast? How do we do tests? How do we pilot? How do we learn? And how do we build?
So Rick, you mentioned a little bit ago the word EMR. I think you might have even mentioned interoperability, or at least it popped into my head. There's clearly been an adoption of EMR, largely driven by meaningful use, oftentimes to the pain and agony of clinicians and patients. I think we're looking forward to the day where we're actually meaningfully using the information. And interestingly, CMS and HHS recognize that there's a huge interoperability problem that's getting in the way of bringing those. And with the new macro legislation, they're incentivizing providers to use interoperable EMRs, which should cause EMR companies eventually to respond, otherwise people won't buy them and they won't be certified. Is it important for you to integrate in the EMR, or can you wait until that world actually exists?
Well, right now we don't integrate, and that makes it easy for us to get into hospitals because if we don't have to bother the IT guys, we can get in a lot easier. But eventually, in order to get the real advantages of using a wearable, we're going to have to be able to connect to all the different types of information systems. So with what we're doing is we have information put out in front of you, and you can be following a process. But why not, in following the process, that automatically documents that it's been done. Then you can use that same idea, speaking naturally, a wearable computer should be able to pick up what you want to do, what you're intending to do. If you're a primary care physician and you're talking directly to your patient, just say to them, I think you should go on prednisone, about 50 milligrams, twice a day. And your wearable will understand that. We'll use the artificial intelligence needed to pick up the fact that it needs to be this drug, this dosage, send it to the pharmacy, and document it, and put it into the patient's note at the end without the clinician having to touch a keyboard, without someone else having to manually add that in there. But in order for this to work, everything has to talk with each other, because I really don't see in the next few years wearables being able to do the type of processing, to do the natural language, artificial intelligence type of duties, tasks that we want it to do. So it has to connect to the IBM Watsons of the world. It has to connect to all the different types of artificial intelligence providers that can help us make those decisions, help us push the information to where it needs to be. But if we can't get past, if we can't get a standard way of communicating, it's not going to happen. And it's the biggest reason I believe that medicine is still so siloed.
And I would generally agree, and I am excited about the changes in the incentive structure, so we'll see how that plays out. So Ashwin, let's fast forward a couple of years. I'm sure you'll have 10 million users on the product. You'll be collecting a lot of data. How does that help me as a user of your product when I walk into Chipotle?
Well, it's a good example. I think the more data that we can collect from different users using the product, the more of an understanding that we'll have around how particular types of patients react to particular types of foods, right? So one of the things that has been incredibly instrumental for us in understanding that nutrition should be personalized in a way is there have been a few studies done in the last few years where folks would basically have hundreds of patients use continuous glucose monitors and eat certain types of meals and see how different types of people reacted differently to foods. And there can be categories of people who react really poorly to carbohydrates when they're paired with fats, for example, or really poorly to sugars in certain types of fruits but not in other types of fruits. So for this Chipotle example, right, if we say you walked me into Chipotle and we said, well, people with your similar demographics, similar age group, similar BMI, similar biome profile, if you do have that information, have reacted poorly to these dishes on the menu. So here's, if you want to optimize for your sugar stability during this meal, here are the 3 options you've got, right? Obviously, that does take the 10 million users, right, that have used the product in order to get to that level of clarity in the data, but that's likely where we'll go when we have that many users.
Super. So investments in wearables and in digital health, it was largely an uninvestable category even just 5 years ago. I know at WellDoc we had to raise tens of millions of angel capital because it wasn't an investable proposition from the VCs. Today it's completely changed. They're dropping $5 billion or more a year. I think I read that there was $2 billion investment in this last quarter. I know, Ben, you had perhaps an interesting funding, and maybe the audience would like to understand. I think some of your money came from DARPA, from NIH funds. Anything you can share in general with companies, especially those that might be working in this space, as to how to go about that, or maybe they shouldn't?
Sure. Well, we have some lessons of that as well. The company, the founders founded Profusa in 2008, 2009. And so Natalie Vishnevsky, one of the founders, she's sitting right there. She also leads all of our grant programs. And I would encourage all of you, if you're interested in the story I'm about to tell, to go talk to her and pick her brain a little bit. Because we've been really incredibly successful at getting government support. And it was driven out of necessity. Because if you rewind the clock in 2009, nothing was being invested in, right? The world economic situation kind of clamped down. To date, we have close to $20 million worth of funding coming from DARPA, NIH. They're very, very competitive grants. And I think a lot of that is actually driven by just tenacity and Natalie and the team's tenacity. But also, we weren't afraid to tackle difficult challenges and hard things. And I think from a funding point of view, especially in a very competitive funding environment, I would actually just encourage entrepreneurs, if you want to get the right partners, if you want to get the right investors, who will not just give you money, but actually are aligned so that when times are tough, they're there to support you. When times are great, they're there to actually help you add fuel to the fire. I think those conversations, those partners will only be there if they believe in your mission and believe in the difficult things that you actually want to do as well. So we're able to do that through the government with DARPA and NIH because we're just tenacious about it, but also paint a very difficult problem that solves some hairy challenges. And then our investor base are kind of feel the same way as well, right? We don't take money for the sake of just taking money. We actually take money because they bring something to the table, and they allow us to either have access to markets or actually have patience and a different way of thinking about it. And I would add a couple of other points, if I may, and I'll stop. You know, the session is actually around igniting markets and igniting opportunity, right, for this whole meeting. And clearly, investment, a lot of what's going to work is driven by the investing in private equity market conditions. But I think if for all of us here, you know, tackling a hairy problem and then using specific examples to be able to actually say, yeah, I've demonstrated from beginning to end. I think in your case, for example, Rick, it might be that one hospital has demonstrated that the integration between your device with EMR and such is small, but you actually demonstrate the use case from beginning to end. I think that actually would be incredibly helpful for this entire industry. Because right now the interoperability problem and the regulatory problem that we all struggle with is I think people try to bite, you know, too big of a bite. And our investors have been great in actually supporting us in that journey. So let's build an ecosystem, no matter how small, and prove that you could add value in the ecosystem, and everybody will jump in.
That's great. And they say, yeah, well, a vision is very important. It's very motivating to yourself, your employees, your investors. They say if you can articulate how to get to your vision, it's not a vision, it's a plan. And Rick, I read something really exciting that the advisor believes physicians should never and will never touch a keyboard again. So perhaps you don't know how to get there all the way if it's a vision, but maybe you can walk us through how you see Advisor contributing to that path.
Well, Advisor's a platform, so it's a way to connect to your technology and get it to where it needs to be. So the vision that I had was, it's very nerve-wracking to be in a hospital, and anytime a person is distracted by a computer following a piece of technology, it's nerve-wracking. I envision being able to walk into a hospital, and the person that greets you by name, and if they need anything from you, you hand their driver's license, they just kind of look at it. Maybe they're wearing glass, maybe there's something that recognizes it, and it gets uploaded into your EMR, your billing system, wherever it needs to be. Every person that interacts with you, they have a way of getting information that they need in order to work with you. They have a way to document what's being happening, either by it recognizing what you're doing, or you can just do gesture control, or you can talk to it and say, I just gave her a liter of saline, and have it go in there. It is possible, I mean, today, with the existing technology, with the existing software, we could make this happen. And so that a physician, one of the biggest frustrations that physicians have, but when I talk to them, try and tell them what we're currently doing, they say, that's great, but if you can help me with documentation, that's really going to make a big difference. And if we can make it so a physician never has to actually touch a keyboard again, interact with patients one-on-one, just talk naturally, and then move on to the next patient, it's going to be so much better. It's going to be so much easier, and I think patients are going to be a lot more engaged in their own care.
Super. So as we wrap up, rapid fire, either what has been the biggest lesson learned, or what's the biggest thing you have to do to be where you want to be next year? And you've literally got like 10 seconds each. So, Frank, you're in the middle of the launch. Your thoughts?
I think it's getting the word out and making sure that consumers know what we're doing differently, and their docs say, yeah, I heard of that, it's great.
I think for us, it's a little bit of consumer education on the best way to use the data that we'll be releasing with our product, and how best to use it earlier on in a patient's life cycle before they have a disease state or condition.
For us, it's demonstrating value across the entire chain of stakeholders, from patients to doctors to providers to payers, even to government agencies, on no matter how small of a scale it is, that using our sensor platform creates tremendous value for each one of those stakeholders. We would demonstrate that case, I think we'll be well on our way.
Our biggest lesson learned is that we can't do it alone. And so from the beginning, we should have been looking for mentors and partners to get us where we need to be and do it continuously.
Well, I learned so much. Thank you. Appreciate our panelists.